Lots of things get passed down through generations. Stories, heirlooms, genetic traits. A new field of study is suggesting that even trauma may be passed down through the generations. Let's dive in. First, what is generational trauma? Well, it's exactly what it sounds like. Trauma that isn't just experienced by one person, but extends from one generation to the next. Here's child-adolescent psychiatrist Gayani DeSilva to help explain.
If you have somebody in your family history who has suffered some sort of trauma, let's say racism or slavery or being the survivor of the Holocaust, that experience in your ancestors does get transmitted from one generation down to the next generation, to the next, and to the next, and to the next.
The concept was first recognized in 1966 by Canadian psychiatrist Vivian M. Rakoff. Rakoff and colleagues recorded high rates of psychological distress in the children of Holocaust survivors. A 1988 study found similar results with the grandchildren of Holocaust survivors. Since then, their descendants have been the most widely studied group, but in theory, any type of extreme, prolonged stress could have adverse psychological effects on children and/or grandchildren. How do health experts spot the signs of generational trauma? There are actually quite a few ways it could show up.
For when you're sitting with a patient, you would look for their specific signs of trauma. So you would look for mood issues or anxiety issues. Those are the primary big symptoms that people typically present with. And then you want to do kind of an investigation of why they feel depressed or they feel anxious or they're having some mood issues. And then you start to ask, why do you think you might be so depressed? Why do you think you might be so anxious? When did that start? Has it always been there? And so when people say, yeah, I feel like I've always been anxious, I've always been kind of depressed, and my mood has always been sort of irritable ever since I was a little child, then the lights got to go off in your brain. You got to think, oh, I wonder what happened before they were even born. I wonder what happened with their parents. Did any of your parents feel depressed or anxious? And then we'd ask about that. And then we'd say, oh, how come they felt depressed or anxious? Were they ever victims of trauma?
Even with all those symptoms for health experts to consider, there's no specific diagnosis for generational trauma, according to the DSM-5, which is the standard classification of mental disorders used by mental health professionals. But the phenomena of intergenerational trauma is well accepted.
It's a learned thing that your brain actually learns, and then the DNA actually learns it and then turns on certain DNA sequences versus other sequences, and it affects brain development. It affects how you learn how to regulate your mood. It affects how your limbic system, which is the part of your brain that is involved with managing emotions, how that develops. And it also has implications on how you react to stress.
Unfortunately, there are no easy answers, but generational trauma can be resolved if a holistic, intense intervention is put in place. This often involves individual therapy, though group and family therapy is another option.
Depending on how severe their symptoms are, so if they're anxious all the time, they're having panic attacks and they can't seem to function as they would like to function in their daily life, we might try medication. So something like a selective serotonin reuptake inhibitor. These medicines are like Prozac, Lexapro, Celexa, Zoloft. Those are kind of the common ones. And we would also highly recommend and want our patients to be in psychotherapy, because psychotherapy is going to help you understand where that anxiety is coming from, where that trauma is coming from, and help you put it in a way in your brain so that you can deal with it, you can handle it, and so it doesn't manifest in symptoms.
If you think you may be experiencing generational trauma, seek help from a behavioral health provider.